Welcome to Senior Health Video. This video will talk about 10 warning signs of diabetes at night that you should never ignore. Have you ever wondered why some nights feel endless, as if your body is fighting against rest instead of recharging? For millions of Americans, especially older adults, the quiet hours of the night hide warning signs that the body is no longer recovering as it should. Sleep should heal, restore, and reset energy. Yet for many, it becomes a battlefield where unseen forces of blood sugar imbalance silently take control. What if those night sweats, frequent bathroom trips, or restless legs were not random discomforts, but messages from your body begging for help? Doctors warn that the earliest signs of diabetes often appear when you are asleep. The body whispers first, then screams through exhaustion, headaches, and vivid dreams that jolt you awake. Ignoring those signals can allow high or unstable blood sugar to damage your nerves, heart, and brain long before you realize something is wrong. Tonight could hold more clues than you imagine. Each symptom that appears after dark tells a story of what is happening inside your blood vessels, your hormones, and your metabolism. Most people blame aging, stress, or simple insomnia, but science now reveals that these nightly struggles are often the first visible signs of insulin resistance building beneath the surface. The good news is that awareness changes everything. Once you recognize these nighttime signs, you can protect your energy, improve sleep quality, and even reverse early diabetic damage. This video will guide you through the 10 most important nighttime diabetes symptoms that too many people ignore. Each one has a reason, a warning, and a solution that could restore your strength and peace of mind. Stay with us, because what happens while you sleep might just save your life. Number 1. Night sweats. The night should bring calm, yet for many people it turns into a storm beneath the sheets. Night sweats are one of the first and most powerful signs that blood sugar is out of balance. Imagine waking up drenched in sweat, your heart racing, your body trembling even though the room feels cool. It is not just the weather or the blanket, it is your body in crisis. When blood sugar drops below normal during sleep, the brain senses danger. To protect you, it releases stress hormones like adrenaline, cortisol, and glucagon, each one pushing sugar back into the bloodstream. This emergency response is called nocturnal hypoglycemia. It may sound harmless, but it is your body fighting for stability. Each episode forces the nervous system into overdrive, interrupting deep sleep cycles and leaving you exhausted in the morning. Doctors from the National Institute of Diabetes have found that up to 60% of diabetic patients experience these nighttime glucose crashes without realizing it. Alcohol, excess insulin, skipped dinners, or even poor meal timing can all trigger the same effect. And every time it happens, the stress hormones build up, increasing insulin resistance the next day. That means more cravings, more fatigue, and faster aging of the body's cells. So what can you do? Keep a small protein snack before bed, like a spoon of almond butter or a few nuts, to maintain steady glucose levels overnight. Avoid late alcohol, which blocks the liver's ability to release sugar when you need it most. Track your bedtime glucose with a monitor and talk with your doctor about adjusting medications that may cause low blood sugar during sleep. But knowing this alone is not enough, because there is another nighttime signal that reveals something even more dangerous, and it often wakes you up for a completely different reason. Number 2. Frequent urination. You turn off the lights ready to rest, but just a few hours later, your body calls again. Frequent urination at night, or nocturia, is one of the clearest warning signs that your blood sugar is not under control. Many seniors think it is just aging or drinking too much water before bed. But the truth is far deeper and far more serious. When blood sugar rises above 180 milligrams per deciliter, your kidneys can no longer reabsorb the excess glucose. That sugar spills into your urine and pulls water with it, forcing your body to flush over and over again. Each trip to the bathroom is not just a nuisance, it is dehydration in disguise. As glucose drags water out of your body, it also removes vital electrolytes like sodium, potassium, and magnesium. Over time, this silent loss can trigger leg cramps, fatigue, and even heart rhythm changes. The body becomes trapped in a cycle of thirst and loss, leaving you tired and irritable by morning. Researchers from the American Diabetes Association confirm that frequent nighttime urination is among the first red flags of poorly managed diabetes or prediabetes. It breaks your sleep rhythm, elevates stress hormones, and weakens insulin sensitivity the next day. Every interruption to deep sleep raises cortisol, the same hormone that increases fat storage and accelerates aging. What can you do tonight to change it? Start by limiting sweet drinks and heavy carbs after dinner, since both spike glucose right before sleep. Keep your dinner balanced with protein and fiber to slow digestion. Stay hydrated during the day so your body does not panic for water at night. And most importantly, check your glucose levels before bed. If they remain high, your doctor can help you adjust medication or timing for better overnight stability. But knowing this symptom is only part of the puzzle, because another sign hides within that same restless night. It does not wake you for the bathroom, but it pulls you from sleep in a different way, leaving your throat dry and your body desperate for relief. Number 3, intense thirst. You just went to bed, but your mouth feels dry as sandpaper. You reach for the glass of water beside you, drink, and yet within minutes the dryness returns. Intense thirst at night is not random dehydration. It is a signal that your blood has become too thick with sugar pulling water from your cells into your bloodstream. The more glucose that circulates, the more your body cries out for water, and the more you drink without satisfaction. This is the body's SOS. When blood sugar levels climb, every cell begins to lose moisture. The brain's thirst center in the hypothalamus detects this dehydration and commands you to drink. You may think your kidneys are working overtime, but in reality they are struggling to remove excess sugar while your cells starve for hydration. As a result, many people wake up multiple times during the night, dry-mouthed and restless, never realizing that high blood sugar is the real culprit. A 2024 clinical review from Johns Hopkins Medicine found that persistent nighttime thirst is one of the earliest markers of metabolic dysfunction in older adults. It not only disrupts sleep, but also increases the risk of kidney strain and chronic fatigue. Every sip you take is temporary relief, while the underlying problem continues beneath the surface. To regain balance, start with simple changes. Reduce sugary snacks and refined carbs after dinner, since they spike glucose and trigger dehydration. Include water-rich foods at dinner, such as cucumber leafy greens or berries, and keep your electrolytes steady with a pinch of sea salt or a magnesium supplement if your doctor agrees. A steady evening blood sugar means restful hydration, not desperate thirst. But just understanding thirst is not enough, because there is another signal that hides deeper in the body. It does not appear in your mouth or kidneys, but in your muscles, quietly twisting and tightening when the night grows still. Number 5, nightmares and vivid dreams. The night should bring peace, yet for many people it turns into chaos inside their own mind. Nightmares and vivid dreams can be more than imagination. They are often a hidden sign of unstable blood sugar during deep sleep. When you enter the REM stage, your brain needs extra glucose for energy. If your sugar drops too low, your body reacts by releasing adrenaline and cortisol, stress hormones that raise blood sugar, but also jolt the brain awake. This sudden hormone surge overstimulates the emotional center of the brain, the limbic system. That is why you may wake up sweating, heart pounding, and feeling fear or sadness that lingers into the morning. What was supposed to be restful sleep becomes a full stress reaction that drains your body. Each episode increases inflammation, raises heart rate, and disrupts recovery. Research from Harvard Medical School shows that people with poor nighttime glucose control have far more dream disturbances and restless awakenings. It is a clear sign that your body and brain are battling to find balance. These nights often leave you groggy, irritable, and craving sugar the next day as your system tries to recover. To ease this cycle, aim for stable blood sugar before bed. Eat balanced dinners with protein and fiber, avoid late sweets or alcohol, and relax your body with slow breathing or gentle stretches. Tracking your glucose can reveal if drops happen while you sleep. When you keep levels steady, your mind can finally dream peacefully again. But even peaceful dreams are not the end of the story, because the next warning sign hides in the shadows of sleepless nights, quietly stealing the rhythm that keeps your body strong and alive. Number 6, trouble falling or staying asleep. You close your eyes and expect rest to come easily, yet minutes turn into hours. Trouble falling or staying asleep is one of the most common and misunderstood signs of blood sugar imbalance. Many seniors believe it is just part of aging, but the truth is that unstable glucose silently disrupts the body's natural sleep rhythm. When sugar rises too high, it suppresses melatonin, the hormone that signals your brain it is time to sleep. When sugar drops too low, the body releases cortisol, the stress hormone that wakes you up in the middle of the night. This constant push and pull between melatonin and cortisol confuses the brain's internal clock. Instead of relaxing, your body remains in alert mode. You toss, turn, and wake up feeling more tired than when you went to bed. Studies from the National Sleep Foundation show that people with irregular blood sugar experience up to 40% more sleep disturbances than those with stable levels. Poor sleep then increases insulin resistance, creating a vicious cycle that keeps repeating. To break it, focus on stabilizing your evening glucose. Avoid sugary snacks or large meals close to bedtime. Eat balanced dinners that include lean protein vegetables and healthy fats to keep blood sugar steady. Try dimming the lights an hour before bed and keeping the room around 67 degrees Fahrenheit to support natural melatonin release. If you still wake up, often discuss your medications or insulin timing with your healthcare provider. A calm night's sleep can restore your energy and improve every system in your body. Yet understanding sleep alone is not enough, because the next morning may bring another sign that your body struggled through the night, one that starts with pain inside your head and fog inside your mind. Number 7, morning headaches and brain fog. The sun rises, but instead of feeling refreshed, you wake up heavy, groggy, and your head throbs like you never truly slept. Morning headaches and brain fog are powerful clues that your blood sugar fluctuated through the night. While you slept, your body was fighting to keep glucose in balance. When it dropped too low, stress hormones kicked in. When it rebounded too high, blood vessels in your brain tightened and oxygen levels dipped. The result is a dull ache, mental haze, and fatigue that follow you into the day. This roller coaster of blood sugar can trigger what scientists call the dawn effect. Before sunrise, your body naturally releases cortisol and adrenaline to prepare for waking. But if you already experience low glucose overnight, this surge can cause an exaggerated spike. Research from the Cleveland Clinic found that up to 50% of diabetic adults experience morning headaches linked to overnight glucose swings. It is not just discomfort. These fluctuations can harm brain cells, reduce focus, and accelerate cognitive decline over time. To correct this, start by stabilizing your nights. Avoid refined carbs and alcohol before bed, since both cause erratic sugar shifts. Have a protein-based snack like Greek yogurt or a few almonds if you tend to wake up lightheaded. Stay hydrated, because dehydration worsens vascular constriction that leads to morning pain. And check your fasting glucose levels regularly to see if hidden nighttime drops or spikes are occurring. Balanced nights create clear mornings. When your brain gets steady fuel, it wakes up sharp and calm instead of sluggish and sore. Yet even if you manage to keep your mind clear, there is another signal that appears deeper inside your body. One that tingles, burns, or sometimes disappears altogether without warning. Number 8, numbness or tingling at night. You lie still in the dark trying to rest, but your feet begin to tingle as if tiny sparks are crawling under your skin. Numbness or tingling at night is one of the most alarming signs that high blood sugar has started to damage your nerves. Many people ignore it, thinking it is just bad circulation or sleeping in the wrong position. But in reality, this sensation reveals that sugar has been silently attacking your nerve endings for months or even years. When glucose remains high, it seeps into the small blood vessels that supply your nerves. This causes inflammation and reduces oxygen flow. Over time, the nerves misfire, sending false signals like burning, prickling, or numbness. Doctors call this diabetic neuropathy, and it can worsen during the night when circulation slows. Research from Johns Hopkins Medicine shows that more than 50% of adults with type 2 diabetes experience nighttime nerve pain or numbness without realizing it is linked to glucose toxicity. This is not only discomfort, it is a warning of real damage. The longer these nerves are exposed to high sugar, the more permanent the loss of sensation becomes. That can lead to foot injuries that go unnoticed, slower healing, and a higher risk of infection. To protect your nerves, focus on restoring healthy blood sugar and supporting microcirculation. Add foods rich in vitamin B12, magnesium, and omega-3 fatty acids like salmon, chia seeds, and leafy greens. Walk or stretch before bed to stimulate blood flow. Keep your glucose steady through balanced evening meals, not extreme fasting or heavy snacks. When circulation improves, the tingling often fades, replaced by calm and warmth. But understanding this signal is only part of the story. because the next warning sign does not appear in your feet at all. It hides in your breathing, and for many people, it begins with a sound they never hear themselves. Number 9, snoring and sleep apnea. The room is silent except for one sound that grows louder as the night deepens. Snoring or pauses in breathing during sleep may seem harmless, but they can be powerful signs of underlying metabolic trouble. Many people think snoring is just a habit or the result of aging. Yet studies now show that sleep apnea and insulin resistance often go hand in hand, creating a cycle that exhausts both the body and the brain. When blood sugar and insulin remain high, the body tends to store excess fat around the neck and upper airway. This extra tissue narrows the breathing passages, making it harder for air to flow freely. As you drift into deep sleep, the muscles that keep your throat open relax too much. The result is snoring, gasping, or even brief stops in breathing that jolt you awake without realizing it. These constant interruptions lower oxygen levels and raise cortisol, the stress hormone that further worsens insulin resistance. Research from the American Academy of Sleep Medicine confirms that over 80% of people with type 2 diabetes also show symptoms of sleep apnea. This condition not only drains your energy, but increases your risk of heart disease, high blood pressure, and cognitive decline. It also makes blood sugar harder to control no matter how well you eat or exercise. To improve airflow and protect your health, focus on both weight management and nighttime posture. Try sleeping on your side instead of your back. Avoid alcohol before bed and keep your nasal passages clear. Gentle evening walks can also strengthen your respiratory muscles. If snoring continues, talk to your doctor about a sleep study to check for apnea. Treating it can dramatically improve blood sugar stability and morning energy. But even when breathing improves, one more hidden danger remains. It does not show through sound or movement, but you will feel it the moment you wake up wondering why a full night's rest still leaves you completely drained. Number 10, waking up exhausted. The alarm rings, the sunlight filters through the curtains, but instead of feeling rested, you wake up heavy, sore, and unrefreshed. Waking up exhausted even after a full night of sleep is one of the most overlooked signs of poor blood sugar control. You may think you slept enough hours, yet your body spent the night under silent stress. When glucose levels swing too high or too low, the sympathetic nervous system stays active, preventing deep recovery. Your heart rate remains elevated, your breathing shallow, and your muscles tense even as you sleep. This constant internal alert state blocks the body's ability to restore energy. Instead of producing fresh ATP, your cells end up with an energy deficit and increased lactic acid. The result is waking up tired, foggy, and sometimes even anxious. Research from Stanford University shows that unstable nighttime glucose can reduce deep restorative sleep by up to 40%. That means your body loses its chance to heal tissues, balance hormones, and detoxify the brain. Over time, this leads to higher inflammation, faster aging, and weaker immunity. To reverse this, focus on supporting true rest, not just more sleep. Maintain steady glucose levels before bed by eating balanced meals rich in protein, fiber, and healthy fats. Avoid late-night sugar or heavy carbs that trigger insulin surges. Create a calming pre-bed routine with soft lighting and deep breathing to reduce cortisol. Magnesium and omega-3 rich foods can also improve nerve relaxation and energy recovery. When blood sugar stabilizes, mornings transform from fatigue to freshness, from struggle to strength. The body begins to heal overnight as nature intended. But just knowing this final sign is not the end, because all these clues connect to one deeper cause, the root of every sleepless night and drained morning, and understanding it can change your health forever. So now you have seen the 10 nighttime diabetes signs that too many people overlook. Each one is your body's quiet way of asking for help. The night sweats, the thirst, the numbness, the fatigue, they are not random. They are your body's warning that blood sugar balance and healing are being interrupted while you sleep. But here is the good news. You are not powerless. The body can recover faster than most people imagine when it's given the right care and consistency. Start with small changes tonight. Eat a balanced dinner with real food, not processed sugar. Stay hydrated through the day, not just before bed. Walk for 10 minutes after each meal to lower glucose naturally. Protect your sleep with calm lighting and a steady routine. These simple actions retrain your body to burn energy more efficiently and to rest deeply again. Your heart, your brain, and your nerves can all improve when you choose stability over spikes. If you recognize even one of these nighttime signs, do not ignore it. Talk with your doctor, check your blood sugar patterns, and keep track of what your body tells you. Health is not about perfection, it is about paying attention. You deserve mornings that feel light, strong, and full of energy. Stay with this channel because the next video will reveal the foods that naturally lower blood sugar overnight without medication. It is practical, simple, and backed by science. Save this video, share it with someone you care about, and subscribe now so you never miss the latest senior health tips and nutrition updates that can truly transform your life. You have the power to protect your health starting tonight, and every small change you make from here forward brings you closer to lasting strength and peaceful sleep.